in Kansas City. Ever since the COVID-19 coronavirus crisis began, we knew that there were many people who could change the way they worked. We knew that there were many people who could change the types of activities that they were doing, but that there would be people who would keep coming to work. Our first responders who every day, no matter the situation, no matter the condition, no matter whether it's a fire, an epidemic, a shooting, anything under the sun, show up to take care of the people of Kansas City, who respond to every 911 call, no matter the part of the city, no matter the epidemic, no matter the time, with the same heroism. And today we're here to recognize the sacrifice of the first person to lose their life who works for Kansas City in the line of duty in connection with COVID-19, and that's EMT Billy Birmingham. I want to first of all thank so many in his family for being here. I recognize that your sacrifice didn't start today. For decades, Mr. Birmingham served this city, for the Kansas City Fire Department, with masks, always, as I've read already, having a big smile, being someone who was congenial, being someone who was known to folks from throughout our community. And even when this crisis broke out, EMT Birmingham had the opportunity to do a different assignment. He got the opportunity to perhaps try to ride this wave out, but instead, like heroes do, he stepped up and he continued to serve his community. We are thankful for his service. We are thankful for his sacrifice. We are thankful for his family and all of their sacrifice. As I said earlier to them, although today we are recognizing his service and sacrifice, I want you to know that Kansas City will remember what he has done for all of us, not just today, not just a month from now, not a year from now, not just 10 years from now, but long term. I also want to say this, not just to his family that's present with us, but to all in the Kansas City Fire Department, to all of our first responders, our health workers, every essential worker right now who's making sure our city and our community can survive. I want to say thank you to you, whether you wear a uniform or you're not, whether you're somebody who's in Kansas City or elsewhere. We recognize that the work that you're doing is how we can make sure that our communities, our friends, and our neighbors can survive. You know, last night, after I heard about Brother Birmingham's passing, I had a moment where I finally said, why is this happening? Why is this virus targeting so many people we love? Why is it that we don't have a solution? Why is it that we're still so frustrated that we can't celebrate this great man's sacrifice? I don't have those answers. But what I do know is that people like him are mentors to so many others. Mentors to anyone out there who cares about his fellow man. Mentors to anyone who cares about his community. Mentors to anyone who gets up every day and realizes that their sacrifice is bigger than that's just in their family or for them, but for everyone in their community. So we want to say as Kansas Cityans, a profound sense of thanks, of gratitude to all of you, to your family, for all that EMT Birmingham meant to us. And I recognize that there will be more that we will do over time, but we thought we could do one very Kansas City thing and turn on this fountain that's a tribute to heroes already, to make sure that he knows that he stands with so many heroes before who've given it all for our community. I'll come back for questions in a short while, but I want to make sure I introduce those who will be speaking with us today. Our Fire Chief, Donna Maize, the head of Local 42 Union, Tim Dupin, and to answer any questions, we have our Director of Emergency Medical Services, Dr. Erica Carney. Chief Maize.
I'm not as quite an eloquent speaker as our mayor, but good afternoon. I'm Donna Maize, Fire Chief. Today we are here to honor EMT Billy Birmingham. The passing of Billy Birmingham deeply saddens all of us in the Kansas City, Missouri Fire Department and brings home the effects of the COVID-19 pandemic. It feels very appropriate to talk about Billy's dedication to service from this place, the Firefighters Memorial Fountain, where the names of all dedicated members of KCFD who gave their lives in service to our city are memorialized. Billy Birmingham faithfully served his community as an EMT for the past 22 years, showing his dedication to serve even in these unprecedented times. He was a kind and professional medical provider that always shared encouraging words and goodwill towards others. Billy was skilled at his craft. Just like Billy, our KCFD responders are the epitome of dedication and service to the residents of Kansas City. On behalf of the men and women of KCFD, I would like to express our most heartfelt condolences to his wife Tondra and his children, grandchildren, and extended family who are here today. I would also like to thank them for sharing him with us, his first responder family. And we, the dedicated members of KCFD, will continue to honor Billy by carrying forward his love of service to the residents of Kansas City, Missouri. The Kansas City Fire Department has been dedicated to serving our city for more than 150 years. Especially in this time of the COVID-19 pandemic, you can rest assured that we are committed to our mission of providing fire protection, emergency medical services, hazmat response, and technical rescue to our community. At the same time, taking every precaution to protect our employees as they serve our city. I and every KCFD employee urge the public to continue to social distance, practice frequent hand washing, and comply with our stay-at-home orders. These are unusual times, but in doing these three things, we can honor the memory of EMT Billy Birmingham and reduce the risk of exposure to our first responders and to each other. It's never easy losing a member of our department in the line of duty, and I ask that all respect be given to Billy's co-workers and family as we mourn his loss. Thank you. And then I'm going to introduce Tim Dupin, who is our Local 42 Union President.
Good afternoon. I'm Tim Dupin, President of IAFF Local 42, and I have the honor of representing the men and women of Local 42. Our heart is broken today, and with the passing of our brother EMT Billy Birmingham. In the last 24 hours, I've heard so many stories of encouragement of how Billy affected all of our lives. He will truly be missed, and I will miss especially when I met him in the halls of the Union, or at the firehouse, or at our EMS headquarters at Eastwood, saying, "What's up, Prez? We love him, we miss him, and like I said, our heart is broken." I will remind you, though, that Billy did not, as I've said, Billy did not lose his life. He gave his life in service to this community. He's truly a hero. He's truly our friend. And like I said, we will miss him. We love him, and we love his family. And we will never forget. We'll never forget his service. We'll never forget your commitment to this city and to this fire department and to this union. And to my sisters and brothers who are still in the field working every day, be as committed as Billy, work as hard as Billy, and be strong, and we'll get through this pandemic, and we'll celebrate his life on a different day. My one regret is that we are not going to be able to properly send off Billy. We'll do our best, but the fire department is full of tradition, and we're going to try to meet as many of those traditions and out of respect to Billy and the family, but it's going to be difficult in these times. So we hope that the citizens of Kansas City realize his sacrifice and his commitment to you and your safety, and ask you to practice social distancing, to stay at home, and to keep us and the Birmingham family in your thoughts and prayers. Thank you.
A few other things I just wanted to mention briefly for you, and then we'll take a few questions. First and foremost, we do want to make sure that we recognize and respect the family at this time that they're grieving. They have asked for you to respect their privacy along the way, and so we do ask that you do that. We will find a time to recognize this hero, and we will give you any plans for that later on, but for now, let's make sure we say thank you and then allow them to grieve. One other thing I wanted to say very quickly is I hope this is the last of one of these times we have to come together. The pain that this family is feeling, this department is feeling, and this city is feeling is something that we don't want to see repeated during this crisis. And an important part of how we can avoid that is making sure we continue to follow all of those instructions we've heard already. Social distancing, making sure that if you don't have to be out, you're not. And making sure that we make life easier for those who are our first responders who have to respond in all of these situations. Keeping your distancing, following the rules, doing those things that are common sense, that are decent, that make sure that we don't have tragedies, more tragedies like this one. With that, we wanted to give you a little bit of time to ask any questions that you might have, and so I'll take those from you as they come around, if any. All right? See, yes. You know, I've said a few times already that I do think it's likely that our stay-at-home order will be extended. We don't know the exact date yet. I think as we're seeing both today, but in other situations, there's still community spread, and we see the result of COVID-19. I know there are some that say that we just need to reopen, but I also would say to any of those, what I don't want to see are more deaths, more tragedies, and to the extent they're avoidable by some of the work and the steps that we're doing now as a community, I'd like to see us continue to avoid that. Yes? So in connection with steps that we're taking to help first responders, this is where I'll bring in Erica. Dr. Erica Carney directs our EMS services, and she can tell you a few steps we're taking to make sure they're safe.
I missed the question. Yeah. So our biggest thing when we look at pre-hospital with sick patients is protecting ourselves. And so what we do is we put a mask on the patient and a mask on ourselves as well, and then having the appropriate PPE, that's the personal protective equipment that allows us to safely take care of patients and protect ourselves. So our biggest thing again is prevention and protection, having appropriate protective equipment that we can wear when taking care of patients. She had asked if first responders were getting enough access.
So we actually, early on, we were able to work with our occupational health group, and they were able to set up drive-through testing for us ahead of many of the other cities across the country that have started that as well. And so we've had really good success with that. Initially, as we were ramping up, the tests were a little more difficult to come across, but right now we're in really good shape with that. And anybody that we put into quarantine due to an exposure gets to be tested. We test them for influenza A, B, strep throat, and then COVID-19. So, and we get the results in about 24 hours. Sorry, it's so hard here. So for the pandemic, I think in our state, it has been decided that that's a presumptive illness. The pandemic is a presumptive illness. I don't know how every state has made that decision, but I know several have. So for the state of Missouri, COVID-19 is a presumptive illness for first responders. And then when we're pretty good about getting information from the health department on positive, patients that have tested positive. And so once we have that information, we go back and trace who responded, what level of PPE they were wearing, and then who else may have been in contact or that our exposed employee may have been in contact with. So, we provide N95 masks, gowns, face shields, gloves, all of those things to all of our responders. What we have done is some of our high-risk employees that have either a compromised immune system or have some high-risk condition, then we've allowed them to present that to us so that we can make those decisions and pull them off of the front lines if necessary. So.
I'm going to say, Bill, you're good. You got a few questions in.
Okay.
We're going to do probably one or two more. Go ahead. Yeah. Well, I think one of the things that we try to get across, not just those of us in elected office, but our firefighters, everyone, is to get people to recognize how serious this disease is, how serious the challenge we have right now is. This is not theoretical. This is not just something that you may see happening 1,000 miles away. There are real families that are impacted. There are lots of people impacted. And frankly, every call now that EMTs are out on, that our fire department's out on, they have to have a consideration of the reality that we're dealing with this. So if it wasn't real before, I hope that anybody who sees pictures of this family, who sees, I think, the sadness that's shared not just in the family, but at the Kansas City Fire Department, would recognize that this is real and that we don't impose these rules. We're not having these types of social distancing proclamations just for show. It's not just for politics. It's to keep people safe. And so I've known all along it's real. Hopefully this reminds people a little bit more and reaffirms what we're dealing with. All right. I want to say thank you all for being here. I hope everybody stays home where they can, washes hands, and says a prayer for this family. Thank you.